question is coming from our Instagram page. And it says, what are some of the practices for healthcare staffing agencies to maintain positive employee relations within their temporary staffing agency, within the temporary staffing space, right? So within our business, we have internal and external employees. So typically the external, the ones on the outside, are your nurses, your certified nursing assistant, your licensed nursing assistant, your nurse practitioner, your, there's so many titles, certified medication aid, so on and so forth. So the nursing support staff types. The internal staff would be more of maybe your scheduler, your accounting assistant, if you have virtual assistants, those will be individuals working internally within the business. And the needs of those individuals are a little bit different because what you need to provide and what you can provide looks different internally than externally just because of proximity. So this question is more specifically talking about the external staff, so those who go out and do the work for the business. And here's a couple of tips from our HR consultant about how to make sure that you're absolutely meeting their needs and kind of staying in tune with what they might need. So one of the unique things I'm going to say is you want to make sure that you're always providing a positive work environment. So even though you can't physically be in the facility or hospital or wherever they may be working, correctional facility, what have you, you want to make sure that the positive energy, the communications, emails, messages, texts, chats are always embodying, hey, what can I do for you today? So making sure that you make them feel like they're valuable assets to your business, keeping them engaged is super important. And here are a couple of other tips. So tip number one, clear communication. And I'm even a person who struggles with that because like Joseph was mentioning, you wear so many hats, but clear communication is key. So you want to keep your temporary staff informed about assignments, policy changes, new company updates, new team members, just so that there's no surprises. Recognition and appreciation. And this is a good one because we are inching up on Nurses Week. And I know you guys have a lot of great ideas that you're going to be doing with your staff for Nurses Week, but acknowledging their hard work. I worked as a nurse on the floor, a lot of you guys as well. It's hard work. 12 hours, 16 hours is a long day. So you always want to make sure that you're acknowledging them for their hard work and more so their contributions in the way that they want to receive it. So I tell people sometimes you have two different types of staff members. You have those who are very monetarily motivated, right? So those are the people that want the bonuses. They want the extra pay for extra shifts. They want to be incentivized in that way. But you also have those who are interested in being incentivized in a way as far as acknowledgement. So they want to be posted on your Facebook page to say, hey, this is the employee of the month and whatever perks come with that. Maybe Starbucks gift cards or, massages or whatever. But, and then other people may, be somewhere else in the mix. They may want to, be able to communicate how they want to contribute to the organization, how they want to see things change. So it really just depends. The next one is competitive pay and benefits. And as nurses, it's really important to be on trend as far as what that looks like. So our pay has changed tremendously over the years. It's not something that's been consistent, especially since the pandemic has happened. So we want to make sure that we know what our counterparts are paying. We want to know what other agencies are paying for the positions that we're filling. The last thing you want as a business owner is to find out through either a customer, but not so much in this instance, but through a staff member working for you, hey, such and such plays X, Y, and Z. Now, when I say understanding the pay, it doesn't mean that you necessarily have to change your pay structure, but you want to be aware of it because most healthcare professionals are always looking, even if they're not interested in moving into another position, they're always looking for opportunities when it comes to what other agencies are looking for. So don't be kind of caught off guard to kind of like, oh, I didn't know they were paying X, Y, and Z. And then the employee feels like an expectation of getting the same. Benefits, yes. Benefit packages, get creative with it. I tell people the traditional benefit package has really kind of gone a little bit to the side where more people are looking for other pieces of the pie that help them do their job easily. A lot of companies offer scrub or some sort of uniform reimbursement. There also is opportunities for you to have partnerships or memberships, whether it be with companies like Peloton or your local gym or Starbucks or Uber Eats. You know, those are all opportunities to kind of support your employees in doing their job. Like I mentioned earlier, 12-hour days are long days. So any way that you can help them do what it is that they need to do, I would encourage it. And also look outside of the box as far as, hey, do I just want to do medical, dental, and vision when my employees really want to have paid time off? They want to have Uber Eats or HelloFresh types of services available to them. And it's not always that as an employee, you have to offer those services for free as much as you want to offer at least initially a discount, which is usually free to your business, to offer those services as a discount versus not at all. Next, professional development opportunities. So providing training opportunities to help them grow their skills, tuition reimbursement. I know a lot of companies are offering student loan repayment, which is something that's eligible for small business is as well. I'll drop that in the chat of this video, the link for that. And then, you know, if they want to continue their education opportunities, partnering with schools, we have quite a few NOSAs here in the group that are also CNA instructors. You know, some run other types of programs within their school. So if that's something that your staff member is interested in, make the connections and make kind of the bridge for them a little bit easier to get connected with those organizations. And then as always, open communication channels. So encourage feedback. I know we've done right after new employees work, you send out a message to kind of say, how did your shift go? I know a lot of the marketplace platforms are offering where you can rate your facility that you went to or post your experiences on a review page that's available for other employees to see. So things like that matter. You want to ensure that one, you're communicating anything going on at your facility to your employees, but also other employee experiences so that you can connect with your client to make sure that everything is going well.